Hey guys, I'm Dr. Ruth Roberts, the creator of the original Crock-Pot diet, and I hope that y'all are having a fantastic day on this last Friday in October. In Charleston, we're finally getting to the reason we all live here. Nice, sunny, beautiful days with low humidity where everybody feels better, pets and humans. So I've had questions around canine cognitive disease, and we don't talk about it as much in cats, but it does happen. So a former client had written in and asked about her dog Charlie Bear, who's now 17, which is remarkable. Go Charlie Bear. He's a lovely, lovely pup, and has been a therapy dog throughout his career and has brought joy to many, many people. But he's unfortunately now facing issues with canine cognitive dysfunction and also with arthritis. And they are noticing that the cognitive dysfunction is increasing pretty rapidly. He's been started on Anapril, which is a prescription medication that's been around for, 10 years anyway, for CCD. They were trying to use it for Cushing's disease, and it just didn't work very well. And then, interestingly enough, it's actually a failure from the human side for Alzheimer's treatment. So there's that. They're using some tramadol and gabapentin for pain relief. And so she's looking for suggestions about how to make him comfortable and make his life as pleasant as possible for the time he has with us on the planet. They're wondering if Sammy could be helpful. And so, yeah, I mean, this is the million-dollar question. What can we do to make this guy feel more comfortable and enjoy the time he has on the planet? So the first thing I will say is that you've got two issues going on here. One is pain, and the other is cognitive issues. And so the thing is which is which, and this is the thing that we start out with. And when I was in practice, how much of the cognitive dysfunction is cognitive dysfunction, and how much of it is uncontrolled pain? And that's the first question. So tramadol and gabapentin are pretty standard issue for pain control. I happen to know that Charlie had some issues with liver function throughout his life, and so non-steroidal anti-inflammatory drugs have not been much of an issue for him, but it is something worth seeing if he could tolerate 1 or 2 doses a week, just to see if it improves his pain control. And then, as far as Western meds go, the other thing that often gets left out is methocarbamol, which is a skeletal muscle relaxer. And so chronic pain, a lot of it is muscle spasm. So something hurts, you kind of crunch up, let's say your neck hurts, you sit around with this crunched up neck, and this is the side that's painful, but you're protecting it over here. So pretty soon, most of the pain's actually over here, not where the actual original pain started. So that can be very helpful. Laser therapy, acupuncture, curcumin, fish oil, probiotics. Does this sound familiar? So what are we treating? We're treating inflammation. Guess what we're treating if it's truly canine cognitive dysfunction? Inflammation, probably. So that's the first distinction I would make. Does he have adequate pain control? If no, get that under, and sometimes the only way you can know whether that's the case or not is to really bump the game up and see if things improve. And so that may be trying a narcotic for a few days. Tramadol is a narcotic agonist, but its pain relief is not fantastic. The other thing that's interesting about the narcotics is there are papers that are beginning to be published that say that narcotics actually worsen your perception of pain over time. And so post-surgically, it's really clear that, and in fact, they're, for kids, they're like, please just give them ibuprofen and don't give them oxycodone or something like that. So what they're finding is that non-steroidal drugs really do a great job. The people that have taken Oxycontin or Tramadol or whatever post-surgically actually have a longer period of time during which they perceive pain and feel painful. So that's not cool. So talk to your doctor about, really pulling out the stops on pain control, based on what your dog or your cat's physiology can handle. If he's got kidney disease and liver disease that's really severe, not a great choice. If the disease is not so horrible, the thing we forget about is that you can use non-steroidal anti-inflammatory drugs every other day, twice a week, and sometimes that is enough to keep the pain under control. So start there. So back to the concept of canine cognitive dysfunction. We've ruled out that that pain is not what's causing him to kind of shut down. We've ruled out that there's not something else going on internally as far as kidney dysfunction, liver dysfunction, things of that nature. So that's, we're making sure that all the obvious stuff is off the table. Hey Michelle and hey Sally, good to see you guys, and you too Susan. Glad you could join us again this week. So let's get into what are these mechanisms behind CCD or canine cognitive dysfunction. And so and hey Donna, so we're talking about Mr. Charlie Bear. You can kind of listen to the earlier part and that'll kind of get you up to speed once the recording's done. At any rate, so canine cognitive dysfunction. On the human side, so I got diagnosed with mild cognitive impairment, as well as this weird dizziness called PPPD, persistent postural perception dizziness. So, it is weird stuff, but it is what it is. So what can I do to make those things better? Well, and that's why I went to the Amen Clinic a few months ago to find out, because I did what I knew, and so they had a few other tricks to throw in there. So from a functional medicine standpoint, canine cognitive dysfunction probably is inflammation. It is probably related to gut dysbiosis, and it is probably just chronic poor diet choices. In the human side, this is abundantly clear, and for many people, they are calling Alzheimer's, dementia, senility, whatever you want to call it, type 3 diabetes. So that tells you something right there. So we're eating diets, the standard American diet, the standard dog diet, the standard cat diet are extremely high in simple carbohydrates, which are the things that we all love and are addicted to. So breads, pastas, cookies, all the yummy stuff. However, that stuff jacks your blood sugar up and creates a whole host of issues there, but more importantly has a profound effect on your inflammation level. And so that's where diet is critically important. So what the Amen Clinic recommended for me, and what I was already doing, to be honest, is keto diet. And essentially that's an extremely high fat, extremely low carbohydrate diet, and moderate protein. So I think that's extremely important. If you're feeding junk, if you're eating junk, your level of inflammation, discomfort, etc., 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 is going to be astronomically higher. Your level of dysbiosis is going to be higher. So it's important to sort out the diet. This you have absolute and complete control over. So I started down that path well over 10 years ago when I had fibromyalgia and a whole host of other issues. It is difficult. It took me, honestly, 3 years before I stopped eating the garbage that I knew was going to create a flare. And I knew exactly what would happen if I ate that slice of pizza. The next day and for 3 days afterwards, I was going to feel like somebody had beat the snot out of me with a 2x4. But it took me 3 years to finally say, okay, that's it, I've really had it. So easier for dogs, they can look at you and beg, and instead of reaching for the begging strips, hand them a slice of a carrot or something else. Hand them a chunk of dehydrated liver, something of that nature. So much easier for dogs. For us, same principles apply. The other thing that is profoundly important is exercise. If you're exercising and moving, you have increased blood flow to the brain, which is improving not only the blood's ability to deliver nutrients to your brain tissue so you can think better, but also to remove waste products. It also delivers more oxygen, and you get all these good things. You start to shift the neurotransmitter milieu, if you will. So you shift it to more serotonin stuff and less things that cause dysmorphia. The inflammatory cytokines cause dysmorphia or make you feel icky. So that's really important. Here's how I can tell you how it works. Yesterday I had a horrible day. I have no idea why. It just kind of comes and goes. So my brain wasn't working. I couldn't comprehend articles when I was reading them. My knees were painful. My hips were painful. It was just bad. So what did I do? I ate, what I was supposed to eat. I forced myself to exercise even though I didn't want to. And I got in the sauna and sweated my brains out. Today I feel much better. Joint pain's gone. Cognitive abilities are much improved, and so that's what it is. Now, I will tell you, Charlie Bear's 17, so do we want to go out and walk him for 30 minutes at a whack? No, it'll kill him, and he'll feel horrible the next day just because he's not accustomed to doing that. However, what you can do, if he's not accustomed to walking at all at this point, is do 3 5-minute walks at relatively large intensity for what he's accustomed to. So what tends to happen is the more we hurt, the less we move, and then frankly, the more we're going to end up hurting. So in Chinese medicine, that is stagnation. So the way to fix stagnation is to move. So for us, for me, I did 2 rounds of body weight exercise, some qigong, and then went downstairs and lifted weights, even though it was like getting started. By the end of the weightlifting period, which was a short session, about 12 minutes, I felt much better because stuff had started moving and my joints weren't as uncomfortable and things of that nature. So those are the 2 biggest things you can do. Adjust the diet so that we reduce inflammation, improve gut health, and move. It's going to make everything better. Secondary to that, control inflammation, improve dysbiosis or bad bugs in the gut, and then resolve stagnation. So stagnation is the joint pain. It is also this not working very well. So the Chinese have amazingly poetic descriptions of what that is. So some of them, like at 3 o'clock in the afternoon when you've got that slump and you want to eat a cookie or have a cup of coffee or something like that, or a 5-hour energy drink, that's called phlegm misting the mind. I just love that. And that's exactly what it feels like, isn't it? It's like all of a sudden this veil just drops and your brain just goes, oh. So that's the best thing you could actually do, is stand up and do some body weight exercises, some wall push-ups, some squats, things of that nature. Your workmates will think you are nuts, but heck with them. Maybe you'll start a movement in the office. The 3 o'clock slump, everybody gets up and does 5 minutes of body weight exercise, and they're, hopefully outside so they can suck up some clean air. Their brains are better. They can get through the last 2 hours of workday. For dogs, okay, maybe we're not going to be doing yoga with them, but we're going to get them outside walking. And again, start slow. As he feels better about moving, he's going to want to do things more than his little body can handle. So just as I've talked about with Esau would like to get out there and run for 30 minutes, and then he will be absolutely crippled the next day. So what do? We take 5 10-minute walks, somewhere between 3 and 5 per day, depending on how things are going for him. If he's super stove up in the morning, we take 3. If he's feeling pretty good, we take 5. Same thing with Mona. She's on the walk, she's having a good day, she's trucking through the whole walk. Little Mona's the mini dachshund. If she's not feeling so great, I pick her up and carry her for a little bit. So mind you, Esau is 15, Mona is 14. These are not spring chickens. But we're doing everything we can to control their inflammation and discomfort. Now, as far as supplements and things go, and I tell you guys this all the time, so I sound like a broken record, but really it's the foundation of health is diet. So crock-pot diet, holistic total body support so that you get a balanced multivitamin in there, and glandular materials to help provide the raw materials for the endocrine system and the other internal organs to work well. So he is, so that's the baseline. The next step is probiotics and fish oil. And the fish oil is a direct anti-inflammatory agent. It also helps to reduce inflammation in the gut. The probiotics are the good guys, so you want to make sure that they are in control, that your pet is eating enough fiber in the diet, which if they're eating the Crock-Pot diet, they are, because you're getting plenty of fiber from the vegetables. So fiber is the food for the probiotic organisms. So make sure that's on board. And then more specific to canine cognitive dysfunction, some of these guys, and with us this happens as well, we talk about sundowner syndrome in people. We see it in dogs and cats too. And so that can happen anywhere from 2:30 in the afternoon onward. They start getting agitated and doing kind of crazy stuff, getting pacey, that kind of thing. Melatonin can be a very big help. For little guys, the dose is going to be somewhere between 1.5 milligrams and 3 milligrams total per day. The bigger guys, somewhere between 3 and 6 milligrams per day. And so you just start with half of the dose in the evening, give it a week or so. If that's not quite enough, bump them up to the remainder of the dose in the morning as well. And that's kind of contrary to what we're accustomed to, but that's very helpful. And then alpha lipoic acid, I have to say, is the home run supplement for cognitive dysfunction. And the dose varies somewhere between 100 to 200 milligrams once or twice a day, again, depending on how severe things are. And so the other ones I would suggest adding in are CoQ10 and then quercetin. And then the other thing for both pain and probably cognitive dysfunction is Canapet. That's really been a big help for many, many, many of our patients. And so I'll have links for that down below in the comments, and I'm looking over to make sure I don't forget anything. And then the other thing is that if the stress level is high, the cognitive dysfunction is going to get worse. So I can tell you that personally. I can tell you that looking at Esau when we were moving, he was just about undone. And so, we were using a lot of things like liquid Nutricalm to help calm him down because his world was in disarray and he didn't understand what was going on. And if you ever need a graphical representation of that, check out the Hyperbole and a Half blog, and there's a blog post in there about dogs don't understand basic concepts like moving, which just will make you roll with laughter. So be mindful of where, what's going on in the household. Is somebody in the household sick? Are you moving? Are you redecorating? Are you having, stuff going on like you're having to take care of your parents? So kind of look at that and recognize that while the stressor may not be in the house, if you are responding to the stress and you're sort of undone, your dog is going to respond to your stress as well. So that's my kind of down and dirty take on what to do with canine cognitive dysfunction. Happens in cats as well. Same principles apply. So Elsa would like to comment on that because, of course, she thinks that cats get short shrift on this program. Right, Elsa? She's like, yeah, whatever. So that's what I would suggest. I'm going to put a link down in the comments section once I finish the broadcast for our mini e-consult form. If you want some help getting some basic ideas together on what to do for your dog for specific situations or your cat, then just fill the form out. It'll come to us, and we'll get back to you within 2 to 3 business days with kind of a series of recommendations. Am I always going to tell you to feed Crock-Pot diet? Yes, unless you tell me that you fed it already and it's not working, and then I'll suggest another diet option. But whole foods that reduce inflammation, improve gut function, and improve the liver's ability to detoxify are critical for making sure everything else works. Now, Sally had a question about her buddy, Rocky, taking carprofen every day for some time. And she's saying, because he's got arthritis, and so she's saying, did I understand you to say that this should be every other day? What I'm saying is that try it every other day. If it works as well, fantastic. Less insult to his liver and kidneys. Awesome. If it doesn't work, it doesn't work. At 14, the most important thing is that he stays comfortable and he enjoys his life. And Rocky is just one of these grand old English setter guys that gets out and patrols his yard, and he's happy about life, and that's where we want to keep him. He's happy. We want to make him stay happy. So it's something worth considering. The other anti-inflammatories you can try along with Canapet is curcumin. So you can get, there is some turmeric in the Crock-Pot diet, and that's where curcumin comes from, but it's at a relatively low dose. To get enough turmeric into the diet to get like a sufficient dose to reduce inflammation is so bitter that it's difficult to get the medicine down. And so that's where, again, fish oil, quercetin can be helpful as well. It's a very strong antioxidant, but it has great anti-inflammatory effects everywhere, including heart and especially in kidney disease. And then curcumin, you can get something like 250 milligram capsules and probably use that twice a day to see about it reducing pain. There's tons of other ones out there, Boswellia, so some of it is hit and miss as well. So some things work great for one dog, not so great for another. So if the curcumin doesn't help, try some Boswellia. If you're not using a basic joint supplement already, so glucosamine, chondroitin, MSM, add that. The one I've been using for years is Arthur E's Gold, because they sort of have the kitchen sink of anti-inflammatory stuff in there. And frankly, for canine cognitive dysfunction, that's not a bad idea to use. Again, glucosamine and chondroitin are potent anti-inflammatories in and of themselves, and as again, they include hyaluronic acid, Boswellia, curcumin, passion flower, a couple of other things that work on reducing inflammation as well. So that is what I know. Let me make sure I don't have any other comments or questions. And then Donna said she's still feeding Crock-Pot diet, and Donna, that's awesome. This is where you want to consider going to a keto version of that. And that's going to be basically extremely low carb. So you would remove the rice. You would probably remove the beans as well. And then add a little extra fat and a little extra protein to kind of make up for the calories there. The goal there is that by reducing the simple carbohydrates, you reduce the amount of inflammation and inflammatory molecules or interleukins or cytokines that are being produced. And so that helps everybody. And Sally, you're very welcome. Love that boy Rocky. He's such a sweetie pie. So guys, unless you have any questions, I think that's all I've got for you today. Again, with those of you that are have memberships for the original Crock-Pot diet, should be getting the recipes for the keto versions up probably next week. As I said, I had a couple of bad days this week where my brain just wasn't working, so it is what it is. I just can't do it that day. So I have to, and making sure everything is right, I want to get it all up there correctly the first time. And so we'll get that up. But essentially that's the basic idea, is to remove the simple carbohydrates, add more fat and protein to compensate. And that's what I know. So until next week, you guys have a fantastic week. And remember, your pet's best health starts in the bowl. Take good care.